Hi, my name's Emily. I'm doing a head-to-toe assessment for my physical assessment class. So we'll just get right into it. I'll start by asking my patient their name and date of birth. So we know that they're oriented to person. I'll also ask them if they know where they are, why they're here, and what day of the week it is. So if they answer all those questions correctly, they're ANO times 4. I'm also going to ask the patient if they have any allergies to medication, latex, or food. I'm also going to let you know that I did vitals before this. The blood pressure was 124/80. The temperature was 98.6 degrees Fahrenheit. The heart rate was 76 beats per minute, and respirations were 16 breaths per minute, which are all in normal range. We also already performed the Snellen chart. So the patient has 20/20 vision, which means that they're able to read all of the letters on the 20/20 line, but not that of the letters just below it. So they do have 20/20 vision. I'm also going to ask the patient about their general mood. Do they wake up happy every morning? And also if they're in any pain right now. Are you in any pain? No? Okay. And now I'll start, I'll do hand hygiene, and then we can actually get started on the actual physical assessment. So I'll start by inspection. I prefer to just do an inspection of the whole body in one go. So looking at the feeling for the temperature of the skin on the face, down the arms, and on the legs as well, and even on the thoracic region and the abdomen. And also just inspecting, do they have any scars, lesions, lacerations, bruising? And they don't, so that's good. We'll move on to inspection of the ears next. So I'm just looking in the ears, looking for any swelling or drainage. I'll turn this side. So there's no swelling, no drainage, a bit of cerumen, but that's okay, that's a normal finding. And I'm also going to perform the whisper test at the same time, so I'm going to whisper something into his ear and have him repeat back what he heard. So, ABC, I'll go to this side, 1, 2, 3. So the whisper test was successful, and at the same time I'm also going to have him perform the Romberg test, because these two tests are indicative of the 8th cranial nerve. So I might as well do them together. I'm going to have him stand with his feet together and eyes closed for about 30 seconds, and really just watch to see how much they're swaying within that 30 seconds, or if they can even do it. And again, that test for cranial nerve number 8. So next I'm going to go ahead and inspect the nose. So I'm just going to look in the nose, again, for any drainage or swelling. The mucous membrane is it's pink and it's moist. And I would also perform the smell test at this point as well. Next is the mouth. So I'm just looking in the mouth, have them stick out their tongue and move their tongue side to side. You look for their tonsils if they're swollen, making sure that the membrane is moist and pink, that there's no swelling or it's not excessively red. And then also having them move their tongue, test for cranial nerve 9 and 10. So the next is vision. So I'm going to check for pupillary constriction and consensual pupillary constriction on the opposite side. So the first pass here, I'm looking for pupillary constriction of this eye, and then on the second pass, I'm looking for the consensual constriction of the other eye. We do it on both eyes. Good. Now I'm going to have them do the 6 fields of gaze. So have them focus on the tip of the pen, and without moving their head, follow the pen with their eyes. Good. So their eyes are perla, and as I said before, we did the Snellen chart earlier, and their sight was 20/20. I'm also going to check for JVD, so just looking at their neck area here, looking at their jugular vein, seeing if it's distended at all, and it's not. We'll also do the shoulder test, so the trapezius muscle, which is also testing for cranial nerve 11. So I'm going to push down on their shoulders, and they're going to resist it, so they're going to try to shrug. And so we did a good job of that, so cranial nerve 11 is intact. We already assessed JVD, but I need to do the carotids as well. So first I'm just going to feel for the carotid pulse, and only do one side at a time. So 1, 2, and then I'm going to sanitize this with an alcohol pad, and I'm going to listen with the bell of the stethoscope for any bruise. So I'm going to have them hold their breath on each side and listen for bruise. I don't hear any, which is a good sign. So then we can go ahead and move on to the lymph nodes. So I'm going to start with pre-auricular, post-auricular, occipital, submandibular, subtonsillar, and submental, and supraclavicular. So I didn't feel any lymph nodes, and you'll also want to ask if they were sensitive in any of those spots. So they're non-palpable and non-tender. And also assess for tenting. So I'm just going to pinch here and make sure that the skin goes back to normal. It's a sign of good hydration. So we already assessed the gait and balance. So next we're going to do the upper body cerebellar assessment. So I'm going to have them close their eyes, point forward, and then touch their nose with their eyes closed. So eyes closed, see if they can touch their nose. Good. And now for the lower cerebellar assessment, we're going to do a heel to shin, which is basically, it looks like a cricket rubbing their heel on their opposite shin. Just like this. On both sides. Good. Next, we'll move on to the chest and arms. So first, of course, starting with inspection, just looking at the thoracic cage, making sure that everything looks symmetrical, that their muscle development is appropriate, and the configuration of the thoracic region as well. And confirming that their respiratory expansion is equal on both sides. Already assessed for skin color, warmth, scars, everything like that. So we're gonna move right into the muscle strength and range of motion. So I'll do range of motion first. So I'm gonna have them raise their arm up to the ceiling from the side, like this. This is testing the shoulder range of motion. And now I'm gonna have them touch their arm to their shoulder. So this is the elbow range of motion. I'm also gonna do range of motion of the lower extremities at the same time. So I'll have them raise their knee to their chest, which is checking for knee and hip range of motion, and then do abduction and adduction. So really this is testing mainly for hip mobility. Good. Next we'll do strength, and again we'll do upper and lower body at the same time. So I'm going to put my hands out and have them, I'll push and they push, and then I'm going to put my hands behind theirs and they're going to pull while I pull. Good. And go ahead and squeeze my fingers as well. Have them squeeze your fingers. And then for the lower body, we're going to do the same as the upper body. So I push against their feet and then they pull. And their range of motion as well as their strength in their upper and lower extremities is pretty good. I'm also going to test for capillary refill. So I'm just going to press on their nail, let go, and see how long it takes for the color to restore back to the nail. So I'm going to do that on both their hands and their feet, and making sure that it's less than 3 seconds that it takes for the color to return. It's indicative of hydration as well as blood flow to the extremities. Next we're going to do the reflexes. So I'm going to cleanse my reflex hammer, and we are going to start with the upper body, and I'm going to tap. This arm right here is going to be loose, and I'm going to tap on the top of their olecranon and watch for their reaction on both sides. Good. And so you're really watching to make sure that they're equal on both sides and that there's an appropriate response and that it's also not hyperreflexic. So we're also going to do the biceps. So I'm going to hold my thumb right here, and we're just looking for essentially flexion of the arm. And then we're also going to do the brachioradialis, and we're looking for supination, so that they turn their arm like this. Right, okay. And then while I'm at it, I'll do the lower extremities as well. We're just doing the patellar reflex, so have them sit on the edge of either their bed or the chair and tap below their knee. Good, equal reflexes on both sides. Next, I'm going to go ahead and move on to the heart and lung sounds. So I'm going to, again, cleanse this, making sure I'm listening to the diaphragm portion. We're going to start with the aortic, which is on the right sternal border, second intercostal space. Left sternal border, second intercostal space is pulmonic. So for both aortic and pulmonic, S2 should be louder than S1. Then we're going to move to herbs, which is on the left sternal border, third intercostal space, and S2 should be equal to S1. Then we're going to do tricuspid, which is on the left sternal border, fourth intercostal space, and S1 should be louder than S2. And then we're going to listen to the apical heart rate, which is the midclavicular line on the left side, and we're going to listen for a full minute. I'm also going to go back and listen to each portion with the bell of the diaphragm, with the bell of the stethoscope, and listen for bruits. So I'm going to do that in each spot as well. And again, for the apical heart rate, you listen for a full minute. Next, before we get into listening to lung sounds, I'm going to check for their respiratory expansion. So I'm going to place my hands on his back like this, and as he takes a deep breath in, they should move out and then back, really just checking that, you know, the lungs expand equally on both sides and that they can expand appropriate amount. I'm going to clean this one more time and then listen to breath sounds. So we're going to start on the anterior side and have them take a deep breath in and out every time you move the stethoscope. Deep breath in, deep breath out, deep breath in, deep breath out, etc. So there's 6 points on the anterior side, 1 on each side for the lateral breath sounds. And then I'll turn them around for the posterior breath sounds. I like to do 8. So we're making sure to avoid the scapula. Breath in, breath out, breath in, breath out. Good. Now we'll move on to the abdomen. First, I'm going to ask some questions. I'm going to ask them about their bowel and bladder habits, when their last bowel movement was it normal for them, as well as their bladder, you know, is there a strong odor to their urine? Is the urine a certain color? The color should be light, like yellow to clear. And if they're having any pain upon urination. So if they're not having pain, that's obviously a good thing. So then we can move on to abdominal inspection, which I kind of already did. Again, no bruising, no scars, no like ascites or anything like that. So I'm gonna go ahead and auscultate for the 4 quadrants of the abdomen. So we're gonna start right lower abdomen, right upper abdomen, left upper abdomen, and left lower abdomen. So you're gonna listen for about 15 seconds, and if you're not hearing anything at all, you have to listen for a full 5 minutes before saying that the patient has absent bowel sounds rather than hypoactive. So all of the regions were normal active, so I can move on to percussion of the quadrants. So again, starting in the right lower quadrant, tap, tap. Okay, and now I can do palpation. I'm just gonna do light palpation, but let the patient know that if they're experiencing any pain during the palpation to let us know. So I'm gonna start right lower quadrant, right upper, left lower. And again, if they're having pain, you wouldn't want to do deep palpation. So for the lower extremities, we already did strength and range of motion. I already checked for the skin integrity. The skin is intact. The skin's warm. There's no lesions or scarring or bruising. I am going to check for pitting edema on the ankles. So just holding the area down, and when you let go, you know, seeing how long it takes the skin to spring back to normal. And there's no pitting edema. We already did the reflexes on his lower body as well, and so now I'll listen to the pulses. So I'm going to compare the patellar pulse on both sides, which is right under the knee, and I'm also going to compare the dorsalis pedis pulses, which are right on top of the foot. And again, I already did capillary refill for the lower extremities as well, so we're all done. Thank you.